So flu, sometimes known as influenza, is a viral infection. It's very common in the winter months. Now, the symptoms that you might see are high fever, which comes on quite suddenly, cough, runny nose, sore throat, muscle aches, and lethargy. And you know, your child might look a little bit more unwell than with other coughs and colds. We've been seeing very large numbers, in fact the largest numbers we've ever seen actually recorded at Birmingham Children's Hospital, and this is really to give you some advice on what to expect, because often this is an illness that can be managed at home. So with flu, your child might look a little bit more unwell than with other coughs and colds. This is normal. Flu is a common illness. The main thing is to keep your child well hydrated. That means ensuring that they're drinking, and you know what you're winning if they're peeing regularly. The other thing is that flu, as I've mentioned before, causes muscle pain, sore throat, that kind of thing, and paracetamol can really help manage some of these symptoms. So sometimes you might, your child might be unwell with symptoms that you're a little bit worried about going on a little bit longer than you think should be. And in those what we call amber cases, you should either call NHS 111 or get in touch with your GP. If your child's breathing a little bit faster than normal, also if your child has dry lips and you think they're not drinking enough, also if they're not peeing enough, also if they have pain which is unrelieved by paracetamol, and also if they have a temperature of 38 degrees or more, which lasts for more than 5 days. So with infants, that's children under 12 months of age, it can be a bit more difficult to work out what's going on sometimes, but things to watch for are, again, poor feeding and not wetting nappies every 8 hours or so. Also, if your child is unconsolable, but despite paracetamol, hugs, or trying to distract them with toys, if they're really not having any of it and they're very irritable, probably best to get onto the phone to NHS 111 or your GP. You have a baby between the ages of 3 and 6 months and they've got a temperature above 39, again it might be worth a call to NHS 111 or your GP. So when should you bring your child to the emergency department? Well, I'm going to take you through some of what we call our red features. First off, very important to remember that babies under the age of 3 months have weaker immune systems than other children. So if you have a child who's under 3 months old, who has a fever, particularly, and also if they feel very cold, so that's a temperature less than 36 degrees, please bring them to the emergency department. Other signs that should bring you back to the emergency department are if they're breathing very fast and you think they're working very hard to breathe. For example, if their tummy's going in and out below their chest, or if they're pale, mottled, or cold to touch. And if you see a new rash in your child that doesn't blanch or disappear when you press it, again, if they're very irritable, difficult to rouse, you're worried about their level of consciousness, they're just not right, bring them to the emergency department. Also, sometimes with fever, children can have a fit or a seizure, and again, that would be a reason to bring your child to the emergency department. There's a lot of information on the internet about flu symptoms in children. One particular website that I'd highly recommend, which is run by the NHS, is called Healthier Together. And if you Google Healthier Together and flu symptoms, that will give very clear advice on how you can manage your child at home, and also goes over again what we've already mentioned in this short piece around amber and red signs that should prompt your bringing your child to the emergency department. The other thing is I would encourage you to get your child vaccinated against flu. That's available for all children with certain exceptions from the age of 2 to year 11. It protects not only your child against flu, but also other members in your household. And the vaccine is very effective and could prevent your child becoming unwell in the next flu season. We've also put some links to Healthier Together and some other useful websites on this short piece. Thank you.